All right, good afternoon, and thank you all for joining Childcare Aware of Minnesota for the September Tell Talk, Early Childhood Educators, a critical link to increasing breastfeeding rates in Minnesota with Linda Kopecki, Interim Executive Director at Minnesota Breastfeeding Coalition. Tell Talks, or Topics for Early Learning Leaders, are monthly webinars for early childhood program leaders to facilitate solutions-focused discussions for your questions about the early childhood field in Minnesota. These one-hour webinars do not meet the standards for a formal professional development training event, and participants will not receive a certificate of completion. Tell Talks are designed as a community building opportunity for leaders to engage and share ideas surrounding a specific content area. We are excited to have moved Tell Talks to Zoom in an effort to build community among program leaders and enhance conversations around our topics. The Tell Talks team consists of Nikki Lepowski, Quality Improvement Coordinator, and myself, Christy Berg, Workforce Advising Coordinator. Together, we work with Corey Woosley and Katie Hoffman at Childcare Aware to coordinate Tell Talks. If you have a suggestion for a future Tell Talks topic, please send one of us an email. Some of our previous topics have included heart-centered leadership and behavior as communication, a panel discussion on supporting children and their teachers. Coming up in October, we will be joined by Hope Dorner from MCTC on the topic of becoming a practicum site and partnering with higher education institutes. Please visit the career advancement page of our website to view previously recorded Tell Talks. After today's presentation, you will receive an email from me with the PowerPoint slides along with any resources shared. Childcare Aware of Minnesota is a resource and referral network for early childhood education in the state. We assist families in finding a quality childcare program. We support the professional growth of early childhood educators with professional development opportunities, eager to learn online training, grants, parent-aware, scholarships, and trainer and RBPD support. We keep the community informed on the importance of quality childcare. Childcare Information Services is a department within CCA that specializes in statewide information sharing and assisting families who are looking for childcare. CCIS sends a welcome packet to new programs, and every 3 years they survey about business policies and tuition rates. The rates are confidential and can influence CCAP reimbursement. CCIS receives calls from program leaders across Minnesota with general business questions and can route you to the appropriate person to contact. Childcare Aware partners with Center for Inclusive Childcare, which provides free relationship-based PD, including support, modeling, and resources to childcare programs throughout Minnesota. A coach will spend time with your program, providing support, focusing on the successful inclusion of children with challenging behaviors or special needs, implementing health and safety best practices, and/or supporting the unique needs of infants and toddlers in your care. Achieve, Minnesota Center for Professional Development, supports individual, trainer, and RBPD membership applicants and approves courses and training events. The Achieve MNCPD website has several resources to share, including a job board, policy info, membership help, info on how to track down your high school diploma, and a virtual career guide. Visit www.mncpd.org to see more. The Tell Talks team partners with several organizations to offer coordinated resources surrounding early care and education needs. As always, participants of Tell Talks are encouraged to participate by engaging in conversation about today's topic. Please ask questions and share comments. We can read through these in the chat feature, or we can take you off of mute to contribute to the conversation. And now I'm excited to turn it over to our presenter, Linda Kopecki. Thanks for being with us today.
Hi, everybody. This is Linda Kopecki. I'm just going to set up my slides really quickly. And I'm the interim ED of the Minnesota Breastfeeding Coalition. So my background is public health. I come from the world of public health. I've been a health educator. But really all of my career focused on breastfeeding or working with families with young children. I've also been a private practice lactation consultant. I've been a little H League leader. I've worked for city government doing community development and community engagement. And the job I had before here in Minnesota as the ED was in Colorado for 6 years, overseeing breastfeeding friendly environment development. So workplaces, childcare settings, public spaces, and medical offices. We started in Boulder County, and then we expanded that model throughout the state of Colorado. So breastfeeding friendly childcare is very near and dear to my heart. So let's get started. So why human milk? Why should we care about the infants and the toddlers in our care receiving human milk? It's pretty well documented that breastfeeding has lifelong health benefits. Lifelong health benefits for baby, and is dose response, which means that the longer the baby breastfeeds or the more breast milk that baby receives, the stronger those protections. So against chronic diseases, acute illnesses, obesity, diabetes, asthma, SIDS, many things. So babies getting access to human milk, breast milk, is good for their entire lives. And you will hear me say breastfeeding, chest feeding, lactation, human milk, they're all talking about the same thing. It's just using different terms can be more inclusive of the parent and the different families. There are parents who are providing human milk who do not self-identify as female. So they may call it chest feeding, they may use another term. So I'll be using some terms interchangeably. But also the parent receives lifelong health benefits too. So the longer a parent breastfeeds, they have a reduced risk of sort of reproductive cancers like breast cancer, ovarian cancer, cervical cancer. And it has to do with the hormone levels and other things that we're still investigating. Why exactly does breastfeeding reduce risk of cancer? We know some things, we don't know other reasons. Also can help prevent postpartum depression or help a person move through postpartum depression, can prevent type 2 diabetes, reduces stress. Regarding postpartum depression, Minnesota Breastfeeding Coalition is actually hosting a workshop tomorrow, a 3-hour workshop tomorrow on mental health and infant feeding. And we have a mental health care provider who's going to be discussing postpartum depression and mental health in the Hmong community and infant feeding. And then we have another person who's going to be discussing surviving postpartum depression as a Black woman and what does that mean within the Black community. So we offer continuing education on all of these topics. So you see, this is provided by the US Surgeon General and the National Institutes of Health. The Centers for Disease Control, they agree breastfeeding is really important, and they have all sorts of resources, and they do a lot of the statistics. They provide a lot of the statistics or collect them for us. They have a report card that comes out every year, sometimes every 2 years, depending on what's happening in the world, like COVID. And they collect a lot of the statistics that are happening at the state level or the county level. But they're a good supporter of breastfeeding. They advise us as healthcare professionals or as public health professionals or even as childcare providers. Also, why human milk? We also know that for families of color, this is even more important. Black babies tend to be born smaller, sicker, and earlier. So they tend to be born more often prematurely, smaller, and breast milk for them is not just providing these lifelong health protections, but it's really to survive. So for many infants, access to human milk for as long as that family wants to breastfeed can be life or death. It could be the difference between poor lifelong health outcomes and very positive lifelong health outcomes. So just a little bit about us. I'm with the Minnesota Breastfeeding Coalition. We talk about supporting, promoting, and protecting breastfeeding in Minnesota communities. So we are not that direct service provider. I am not going to go out and counsel a family about managing their breastfeeding challenges, but we work with those parties that are working with families. We support breastfeeding coalitions. We help launch breastfeeding coalitions. We helped launch the Indigenous Breastfeeding Coalition of Minnesota, the Hmong Breastfeeding Coalition of Minnesota, and help support local coalitions develop, because they really work with the families in their community and they're in tune with the families in their community. And those are the parties that work with the child care providers in their community. So if you have questions about breastfeeding and need to have some answers about, do I wear gloves? What about milk in the toddler room? What about training? What about being designated breastfeeding friendly? Your local health department is a really good source, or your local breastfeeding coalition is a really good source. We also provide resources for lactation professionals and lactation advocates. So those are folks who are working with families directly. The role of supportive environments. I just want to talk about that a little bit. We know that in Minnesota, we have a lot of women participating in the workforce. And it's the second highest, as states go, has the second highest rate of women participating in the workforce. So a lot of our moms, after they give birth, they're going to go back to work. Minnesota, we have pretty good initiation rates. There are 3 statistics that we look at in breastfeeding. There is intention. Well, actually 4 statistics. Intention is a little bit harder to gauge. So that's, am I going to breastfeed? The 3 that are easier to measure are initiation. Did the baby ever breastfeed at all? And we get those from hospital statistics and birth certificate data. Duration, how long did that baby breastfeed? Did they breastfeed 2 months, 4 months, 12 months, 24 months? The average, the worldwide average age of weaning is about 4.5 years. In the United States, it's much, much younger. We do not really have a culture of extended breastfeeding in the United States. Other cultures have a robust history of breastfeeding for quite a long time. And then the third statistic that we really can quantify is exclusivity. So that means babies receiving human milk and only human milk up till about 6 months when they're ready to start solids. So not introducing formula before 6 months, not introducing solids before 6 months. But that exclusive breastfeeding is also really important for those babies. It helps their immature gut to be resilient and resistant to harmful bacteria. It helps the gut mature. It also helps them develop those lifelong health protections. The microbiome that's created by an exclusively breastfed baby looks very different from one that even receives a little bit of formula. So in Minnesota, we also know that across all regions, breastfeeding rates at 2 months drop. They're lower than the Healthy People 2020 goal for 6 months, which is about 60%. So if 90% of our babies start out breastfeeding and at 2 months it's lower than 60%, you can see there's a sort of a cliff that those numbers really drop off. You'll look at this, this chart and you'll see that everybody starts out pretty high, all ages, but then it really drops off. And the different colors are the different ages of the mother. And this is some WIC data. Additionally, we also know, and this is a study from the Maternal and Child Health Journal of 2013, Betat et al., that child care providers who provide breastfeeding support at 3 months, up to 3 months, particularly feeding express breast milk and allowing mothers to breastfeed before or after work, they can help parents have longer duration. So you are helping families reach their breastfeeding goals. You're helping them breastfeed longer. So childcare providers definitely have a specific role in supporting breastfeeding duration. So attitude is really everything. In public health, we talk about, when we want to make a change, we talk about changing knowledge, attitude, and behaviors. Knowledge is pretty easy. Here's the information. Here are the statistics. Here's a learning module. Behavior, those are those expectations. We expect you to, prevent COVID. We expect you to wear a mask. We expect you to get immunization. We expect you to socially distance. That's behavior. The attitude, how you feel about something, what your culture or what your family tells you about something, that's very, very challenging. And every single one of you, your attitude will, and your personal experience and your feelings will reflect on how you support breastfeeding in your system. So we have a little poll I'd like to launch. And I want you to click on the response that seems the most, that you resonate with the most. So there's going to be a variety of sentences, and you may have to scroll, look at one and scroll over to see the full sentence. And maybe one of these does not fully express your feelings or experience, but choose one that's closest. There's no right or wrong, but this is just gauging, just showing that our experience, our history, our culture, our lack of experience, it will definitely influence how we support breastfeeding in our systems. Okay, so we have 3 more people to respond. Okay, and I think we have 1 more person to respond. Okay, very good. Okay, so you can end the poll and then share results. And if you all, are you able to unmute yourselves? I would love to have your reflections on this. So half of you said that you personally had difficult experience, but you do everything to support families. So you want to pay it forward. Any comments, any reflections on that particular statement?
For those of you that are joining, I just wanted to let you know you can unmute yourself. I enabled that option, so you can type in the chat box or you can unmute yourself, and feel free to let us know. We have a small group, so feel free to do that too. And Linda, could you just repeat the question?
Yeah, so just I'm looking for some reflections on some of these responses. So this one had 4 out of 8 said this resonated most with them. I personally had a difficult experience, so I do everything I can to support families who are breastfeeding. So it's sort of paying it forward. And often that's what we're doing. So if you have a comment about that, please share, or a story, or even a reflection.
So I answered that one with, I had difficulty personally, but I know how great it is and how I have a lot of family members who had a wonderful experience, like no difficulties at all. And so it just gave me that motivation that I can do it. But yeah, me personally, it was hard for I have a 1.5-year-old right now, and I only lasted about 9 months, but I still take that as a success. So
that's a win.
Yeah.
This is definitely a win.
Yeah.
Especially when it's really challenging.
Yes.
And just to know that some individuals who have negative experiences, they bring doubt to the center. They bring doubt. They are discouraged. maybe they were discouraged, or their family or culture kind of fed into that discouragement. So a personally challenging experience, how you approach working in the childcare setting, it may be positive, it actually may not be positive. So thinking about that with your coworkers and your staff. I'm wondering if there's something in the chat. So, oh, I don't have a mic, but I tried for 2 weeks and was very upset every time I pumped and tried breastfeeding. My daughter didn't latch on well, but I'm always pushing and recommending breastfeeding for families and friends. Yeah. So, I mean, that's negative personal experiences can move forward as positive support, or it could move forward as discouragement and doubt. A couple others that people mentioned were, I personally had a great experience and love supporting families and staff. Anybody have a comment on that? It doesn't have to be that you responded that way. But if anybody has a comment, share in the chat or unmute yourself.
Sorry, I can share. I had a really positive experience. I actually was fortunate enough to take my daughter to a child care provider that I had been the lead teacher for, and she was my assistant for several years, at least 4 years. And when I had went to management, she ended up moving to have her own babies and open her own family child care. So by the time we had kids, it was kind of already set in stone that that's where I wanted her to go. Very same philosophies and values. But I always say to all my programs that I work with that I know a lot about the different age groups and a lot about development, but I knew nothing when it came to being a newborn mom or breastfeeding. And so I felt really challenged by breastfeeding in the first few weeks. My daughter was born pretty small, but she was a full-term pregnancy and delivery. And so they really, the hospital that I went to was amazing, but the pediatrician was really pressuring me to supplement with formula or pump as soon as I was done feeding her. So they had, my lactation consultants were all really supportive and helped me a lot, but the pediatrician was saying, no, she needs more. You need to pump right after you feed her and then give her the bottle. And I was so overwhelmed by it in those first couple of weeks that I really didn't think I would make it long. So I set a lot of short-term goals for myself. First I said 6 weeks, and then I said 2 months, and then I said 3, and then I said at least 6 months. And eventually we made it to 14 months, which I would have kept going longer, but she kind of dipped out. So my daughter, but anyway, so my childcare provider that I had when she was an infant was amazing and supportive. And every time I asked if I could nurse her quick before I went home, it would save us, the trouble of that being the first thing we had to do when we walked in the door, when I had X amount of other things and I knew it would probably get pushed off and we'd ruin her routine, or I would get stressed, and we know what that does for supply. So often I would just go upstairs with my daughter into a room she had with a rocking chair, and she provided that space. And she even said I could, in front of her if I felt comfortable. And she was a nursing mother herself, but didn't go as long as she would have liked. And so she was really in support of helping me do that with my journey with my daughter. So I was very fortunate to have that. And now they moved to the cities, unfortunately, and we had to find different childcare, and I'm expecting again. So I'm a little nervous about what that's going to look like with my new program. So I think that she's going to be fully in support, but I definitely want to have conversations prior so that it doesn't feel like it's kind of on the spot if she seemed uncomfortable when I asked if I could. But she lives 15 minutes away from us, so it would be really beneficial to be able to do that if I could. So I think I need to get up the courage to ask that so that I can have another great experience again.
I want to lift up a couple of things from what you said, Mallory, and congratulations on being pregnant.
Thank you.
So one is that a positive experience can have challenges. It doesn't mean everything was unicorns and rainbows and, all beautiful, right?
Right.
It means that it worked out and you got close to your goal. And, so positive and difficult, those are perceptions that each person has. But also what you bring to your childcare setting is a realistic view of goal setting, little chunks at a time of, some of those challenges of trying to find support. The second thing is we know that even in childcare centers or licensed homes, particularly in family friend and neighbor providers, that it's that parents that's doing the heavy lifting of educating them about breastfeeding.
Mm-hmm.
It is often the parent that's saying, okay, we need a feeding plan, or I want to be able to come. Can I come during the day? Or please don't feed my child, within an hour of when I'm due to pick them up, or only give 2 ounces. They're doing the educating. And wouldn't it be wonderful if there was another system to make sure that all childcare providers received that standard training and education about storage and handling and feeding and normalizing breastfeeding. I just want to comment really quickly on number 5. 2 people mentioned this here, that I never breastfed, but I think it's a great thing, so I try to be supportive. Do you have to have breastfed to be able to be supportive? No, you can learn about breastfeeding. And maybe every person on staff at your childcare center has never breastfed, but you can still have a really positive attitude. You can have the knowledge about what it means to be breastfeeding friendly and supportive of families and staff. And you can exhibit all the good behaviors about being a supportive environment. So you don't have to have breastfed to know how to support breastfeeding families. So I'm going to stop sharing. And let's go to the next slide. Thank you so much for sharing stories. I really, really appreciate it. So what do we mean nuts and bolts about that breastfeeding friendly childcare setting, or that's those supportive early childhood settings? So there's something, so this is not a full training, but I'm sort of giving you a teaser for what is in the trainings for becoming a breastfeeding friendly childcare setting. So Minnesota Breastfeeding Coalition is working with some community partners to put together a 2-hour training module for the Anytime Learning platform. And it's going to be at no cost. And we're almost done with it. It's our workplace and childcare team that's putting it together. But this is just a little bit of a teaser of what you can find in training for your childcare setting and what it means to be breastfeeding friendly. You want to make sure that staff are trained regularly. There's turnover, right? There's turnover in staff. So every time a new staff person comes on, or even as reminders annually, training. And here's an example. I'm just going to make sure that I have, good, sharing the sound. This is an example of learning hunger cues. And these are little snippets that the Minnesota Department of Health WIC office has.
Oh, not my shoulder. Okay, okay, okay. I know. Not as appetizing as it.
Okay, so using little videos of hunger cues and all of the baby behavior. This is a program, Baby Behavior, that comes out of University of California, Davis. Really helpful in understanding what the different cues are. Because if you get a baby who's crying and screaming, that's very late, right? They are way beyond their early hunger cues. And you have to settle them down and quiet them down and soothe them before they can possibly eat. I'm sure you've experienced that with infants many times. So another thing that we look for is a commitment to breastfeeding. So making sure families know that breastfeeding is welcome in that setting. So they can, and I know COVID has upended a whole lot of things about if parents are actually allowed in the childcare setting, but in times when parents are allowed, they can come in and there's a space for them to nurse before they drop their child off. Maybe they can come during the day and nurse during their lunch hour if the childcare setting is pretty close to where they're working. Or and Mallory, I think you're the one who was saying that you would get there early and nurse really quickly just so that everybody was content on the drive home. And that wasn't the first thing you had to do when you got home. A commitment to breastfeeding means also that you support your staff. If you have staff who are having babies, and we know a lot of the people working in childcare settings are of childbearing age and they're women, and they tend to be lower income and hourly workers. And it can be really challenging for them to get their time and space. What's a little bit different about a childcare setting, it may not be about pumping when they need to express milk. Maybe their baby's in the infant room. So how do you arrange it? How do you show your commitment to breastfeeding? By arranging for that staff member to be able to breastfeed when they need to breastfeed and not necessarily pump. And that's going to be a different schedule. And so policy is important to demonstrate that commitment. Policy towards the families you serve. What are those guidelines for those promises that you have to the families about breastfeeding? That you will be trained, you know how to handle breast milk, you will use paste bottle feeding. Also a commitment to your staff. Do you know how to store breast milk? So you will learn proper storage. This is from the Minnesota WIC office. It's about how do you store human milk. And the little bottles may come to your center frozen, or they may come thawed, but just making sure that you're following all the guidelines for keeping that milk stored at the temperature it needs to be stored, and you're warming it up as it needs to be warmed up. Also, how are you handling breast milk and how are you feeding? This is a picture of paste bottle feeding, which is a great skill. It's a great thing for childcare providers to learn. And it mimics the rhythms of breastfeeding. So it allows a baby to go from bottle feeding to feeding at the breast a little bit more smoothly because the rhythm is the same. They're able to self-regulate. We know that infants that receive breast milk and breast milk for a certain duration, particularly, that they have less chance of childhood obesity or adult obesity. And we know there's two schools of thought about that. One is that infants that breastfeed and also will wean themselves, that they know how to self-regulate. They know the feeling of full, they know the feeling of thirst and hunger, and they respond to that. They self-regulate, and that self-regulation goes well beyond the period that they're breastfed. So we are looking for environments that normalize human milk feeding. Has anybody ever seen these cute little animals with, there's the dog, the kitty, the hedgehog, the bunny. These are very, very cute. There's little magnets on the animals' nipples and then the puppies or the babies' mouths. So, or there's little books about animals nursing or people nursing. Posters, maybe you can get posters from your WIC office. There's all sorts of ways to normalize human milk feeding in your environment. It's not all about bottles, it's not all about formula. It's really, this is normal. This is what's expected. This is how we operate. We totally support breastfeeding. So I want to do a final activity, and I know that we have some good amount of time, which is great. So I am going to put something in the chat section. So this is a Padlet activity. I don't know if anybody has ever used Padlet. It's a fun activity. So this is like a virtual sticky wall. So if you click on the link that I put in the chat section, then you can start populating this board, this sticky wall. So I'd love for you, and this is a time for us, you unmute yourself, you can talk, you can share your notes. But the way you do it is you click on one of these plus signs and then you add a comment. And once you've added your comment, you can click anywhere else on the board and that comment will show up. But I'm looking for what have you noticed as challenges in supporting breastfeeding in your childcare setting? What are some opportunities you've noticed for promoting and supporting breast or chest feeding? What's your personal next step, or what do you still need to learn? I'd love for everybody to post a few things, and then we can have a bit of a conversation about that. If anybody's having trouble, I see a few people writing. And then again, when you're done, and you can actually add pictures. Okay, so opportunities promoting Minnesota Breastfeeding Coalition services. And if you, so for example, if I want to learn about pace bottle feeding, I can also do a picture. So I'm going to do ... image search. Right, and this is a good picture of pace bottle feeding. So then so you can add a picture. So challenges in supporting breastfeeding. Your community does not support you to breastfeed. Is there any, does anybody want to talk about that a little bit more? Is that your geographic community, your cultural community, your family? It is really hard when the people who are supposed to be your support system are not supporting your choices. Yeah, cultural community, exactly. And so Amy, I'm just assuming by your last name that maybe you're Hmong. And it is, and maybe not. Let's see. Yes. Okay. Well, and there is a Hmong breastfeeding coalition because we know that Hmong breastfeeding rates are some of the lowest in the state, and it can be very challenging. Some elders are very supportive of breastfeeding. Some elders are not supportive of breastfeeding. We have a few stories that I'm sharing at the workshop tomorrow on mental health and infant feeding. And 2 Hmong women shared their stories about postpartum depression, but also about breastfeeding. And one person said that her in-laws forced her to, she really wanted to breastfeed, but her in-laws forced her to start using formula because they wanted their children to be as tall as Americans are, because they were genetically shorter people. And how challenging is that? You respect your elders, right? So people's judgments. Provider does not support breastfeeding. That's a huge challenge. Some people can change providers. Some people don't have a choice and they cannot change providers. Yes, difference in views on feed when hungry versus getting baby on a schedule. That can be really challenging. In a childcare setting, who makes that ultimate decision? Is it the childcare setting? Is it the family? Is it maybe their doctor that says they need to have them on a schedule? So opportunities promoting Minnesota Breastfeeding Coalition with programs through different childcare settings, definitely. We want to make sure that we work with our childcare providers throughout the state to have optimal settings for breastfeeding families. Licensing rules around feeding and storing breast milk in infant and toddler center classrooms. Absolutely. So that is definitely a part of the breastfeeding friendly childcare training. And we also definitely touch on the toddler rooms. That can be a challenge. We know that the health specialists, why am I blanking on what they're called? The nurses or so who provide health guidance for the childcare centers. Why am I blanking on their name? Somebody help me.
We always had at my
Health
center.
consultants.
Yeah.
Health consultants. Okay. Yeah. Yeah. So, yeah. It's been a challenge trying to, just make sure that health consultants are also totally versed in how important it is to support breastfeeding and how important it is to have breast milk available in the toddler room if the family chooses that. Have under opportunities, have open conversations about expectations parents have when it comes to allowing breastfeeding in programs and what the program's willing to or able to offer. A lot of families will say that their childcare setting is their second family. So I don't know if I'm sure you've heard that's their childcare provider is like their second family. And there can be an intimate relationship between the childcare provider and the family, as you know. So that means there's a lot of opportunities to be supportive, to problem solve, to have clear communication about expectations. Next step, promote breastfeeding courses for early care educators, collect brochures and handouts. Somebody works with pregnant and parenting teens. Definitely. That's a very specific population. Explore resources. So feel free to unmute yourself. Any comments on any of these or anything you resonate with or anything that you have a response to?
Linda, I wanted to ask if there were some brochures or PDF files that I could attach in my follow-up email to share with our group.
So we're specifically for breastfeeding friendly childcare settings, there is, and I don't have them at my fingertips right now. We just right now are reforming the workplace and childcare team of the Minnesota Breastfeeding Coalition, and we're taking on childcare with sort of a renewed zeal right now, because there used to be a training for childcare providers. It's outdated, and we're refreshing that through the Anytime Learning. So we don't necessarily have all of the documents, but I can send you some to send in a follow-up email if you'd like.
Sure.
We'll do that. There are some really good resources. A lot of the resources that we have, we borrow from other states. My goal is to create Minnesota-specific resources. Any other comments or thoughts about any of these? Any reactions? I'm interested in the person working with pregnant and parenting teens. Is that that include a childcare setting, or is that in a school district? I can't see who wrote these, unfortunately. Mm-hmm.
Linda, I have a comment. I mean, a lot of the things kind of sound like things that you might expect, but there's just a lot of opportunity, it looks like, to learn more and also to share the resources. One question that I had was, maybe, I don't know if you're going to get to this later, or if I'm jumping ahead, please just let me know, but maybe opportunities or challenges that this has been impacted by COVID, or if there's been any changes to how you might approach that.
Mm-hmm. One thing that we're noticing with COVID, and not going to say specific to the childcare setting, but in general about breastfeeding, is that Well, a couple of things that we've noticed as far as breastfeeding and COVID is that, well, actually three things. So the first thing is that hospital stays will tend to be shorter. So it used to be that it was 48 hours. And it was our own Senator Amy Klobuchar that really pushed that legislation through that mandated a minimum 48-hour stay for mom and baby, just to get things going. And during those 48 hours, the lactation consultant at the hospital would spend a great deal of time with the family and be able to see that baby latch probably on the second day and maybe have a full feed. When you're leaving at 24 hours, there's a lot that needs to be done. And the lactation consultants that we know in the hospitals have said that they just don't have time. There's no way to really get to all those families. So a lot of that learning is not happening in that hospital stay, but it needs to happen when they're back home in the community. So the community support people, which could include childcare providers, workplaces, but mostly those medical providers and the peer support folks like WIC, they need to pick up a lot of that education, and they have been. The second thing that we've noticed with COVID is that there's been a bit of an increase in hospital formula feeding. So that can be called supplementation, but we want to differentiate supplementing with human milk, like donor milk or mom's own milk if she pumped, and supplementing with formula. But we've noticed that, and this is through Minnesota Department of Health WIC, and they've looked at birth certificate data, and they've also looked at WIC statistics, that in-hospital formula feeding is not going down, which is what we want, but it's actually starting to go up again. And we think that's an artifact of COVID. Oh, here's a comment. Right, and then I think with childcare too, the ability for the parent to be in the childcare setting has really impacted just being able to feed on demand, or being able to take care of that baby's needs during the day. And an example of a way a childcare setting, this is when I was working in Colorado, how they worked with a family is, this was an FAA facility, so a Federal Aviation Authority facility in the town where I was working. And a lot of federal facilities have childcare either on site or co-located. This one had a childcare setting across the parking lot. And the director of that childcare setting was working with somebody who worked at the FAA, and they had a lactation room. They were, really supportive of her, but she just did not like pumping. Pumping didn't work for her. She didn't get very much. She really just wanted to feed on demand. And so when she expressed that frustration to her childcare provider and saying, I'm just going to quit because I hate pumping, they said, well, you're across the parking lot. Why don't you come over on your breaks and come over on lunch and breastfeed? So she ended up breastfeeding for 6 more months because of that problem solving with the childcare setting. So when parents can't come into the childcare setting, those kind of solutions to those types of problems are off the table. Any other questions that you have? I'd love to have some more questions. COVID is hard because we don't really know. There's going to be a new normal in the world, and we don't really know what that new normal is. So we're just riding the roller coaster, waiting for the new normal to present itself.
Linda, that workshop that you mentioned that's taking place tomorrow, are there still seats available, or is registration?
Oh, yeah.
There are?
Yeah.
Would our participants be able to get that info?
Yeah, I can put the registration in the chat section, and it is $30. because there's continuing education units attached to it. But let me just get the. Here, I'll share. Yeah. So here it is. You can just read a little bit about it, and I'll put this link in the chat section so that you can, if you're interested in registering, it should be really, really interesting. And we do have, as I said, we try to embed storytelling and story sharing in all of our workshops. So we have 3 moms very, very bravely sharing their experience with postpartum depression. The 2 Hmong women preferred to remain anonymous. They only shared on that condition. But there's a 3rd person who, she's Native American, and she's sharing her story of postpartum depression too, but also how it affected or its relationship with breastfeeding. So just, I am concluding my bit of the presentation, but I'm just wondering if there are any other questions or comments or thoughts about next steps. Does anybody have a childcare setting that is breastfeeding friendly, that is designated, or you think has really good supportive practices?
The child cheapers. Every time I try to talk, I can't. The child care center that I worked for 7 years prior to becoming a coach had a dedicated nursing mother's room. The tricky part with it was, you know, out of the 40 staff they had, roughly, several of those moms were breastfeeding moms, and often they were reserving the room for so many hours of the day that it really was never used by the parents. So I can't recall, and I was just trying to think about it, if parents were then breastfeeding in the classroom, if they felt comfortable with like with the rocking chairs that were in there or whatever. But I don't remember parents utilizing that space, but the staff definitely did. And the staff that had infants there at the center brought their infants right in there. And the staff that didn't would just pump in there. So.
And that's actually what we've noticed in other childcare settings when there's a private space, that a lot of the parents will actually prefer to nurse in the infant room. And there is an added benefit. I don't know if you know this, the added benefit to nursing in the infant room is that when the parent is exposed to the environment that the child is in, they will develop antibodies specific to that child's environment. So those antibodies they're developing by being in that infant room will, be in the breast milk, and the baby will get those antibodies. So they are actually receiving protections specific to their environment at the child care setting when the parent is there and exposed. So that's an amazing benefit of being able to nurse and spend time in the nursery. Does anybody else have, maybe it's been a challenge to set up? Yes, our bodies are totally amazing. You're right, Nikki. Our bodies are absolutely, totally amazing. Anybody else have challenges or thoughts about their particular setting or what they want to do with their particular setting? I mean, just a reminder that childcare training is coming up. It'll be on the Anytime Learning platform. I'm hoping no later than January 1, hopefully much earlier than that. So just
Linda, I just wanted to share, I have quite a few programs that I support and in preparation for today. Not a lot of them could make it because obviously they were experiencing some staffing issues, but they were curious and excited to hear some of the resources that you were sharing. And one director shared specifically with me, she was so proud of her program was nationally accredited and that was embedded in some of their standards already to, ensure that they had a space available. So she was going to just explore that a little bit more. So she wanted me to share that too.
Mhm. Nice. Good. Well, so thank you very much. I appreciate being here.
Thank you, Linda. We're so glad you were able to take time to share your expertise and to invite our participants to share their experiences. And we want to thank all of our participants for engaging in the dialogue, the Padlet, and the poll. You can look for my follow-up email that'll be coming in the next few days.
Great. Thanks, everybody. Have a wonderful afternoon.